Hello, I'm Dr. Ramsey Amin. The topic today is thin gums and dental implants. You're either born with thin gums or born with thick gums or somewhere in between. Many people develop what's called gum recession, most of the time due to brushing too hard. Gum recession is where the roots of your teeth become exposed. It can cause a problem in dental implant therapy or bone grafting when the gums are thin. The primary thing that we see after an implant is placed into thin gums is that you can see the implant through the gums as a grayish, even black-like structure just below the gum, kind of like a shadow. Besides the aesthetic problem that can be, thin gums lead to bone loss and recession around dental implants. There's a triad of issues I look at prior to placing implants in anyone, especially in the front of the mouth, are three things. First being the implant design, second being the design of the crown itself, and third being the position of the implant. If you have thin gums and those three factors are well thought out before the implant is placed, you can have a really successful, nice, long-lasting dental implant. With regards to the design of the crown has to have some concavity in the area nearest the gum to develop some thickness of gum there. What we call platform switching on an implant helps also. Smaller implants help in the front of the mouth because they're a little bit further away from the surface, and placing implants a little bit deeper or towards the tongue side help also. So the design of the crown, the design of the implant, and the position of the implant. There are many techniques that I use in addition to those to help create thick gums if you don't have genetically thick gums. Remember, thick gums are better than thin gums for a dental implant, even your natural teeth, because they're much less prone to recession. One is adding gums or adding bone before or during the implant placement, meaning gum grafting or bone grafting. Second off is, if you have thin gums, perhaps using a custom abutment that's white underneath that won't show through as a metal structure, titanium, through the gum line. Obviously, placing the implant in the right spot is key determinant. And the other thing is, during surgical placement of implants, I oftentimes borrow a little bit of gum from the inside part and push it to the outside. Through some fancy stitching, you can actually reposition the gum line towards the outside, and that helps tremendously in kind of borrowing gum, making areas that are thicker, making areas that are thinner thicker by borrowing from one area to another. Again, this is Dr. Ramsey Amin, dentalimplantdentistryblog.com, or my website, burbankdentalimplants.com. Please feel free to comment, or I have a Facebook fan page that you can find me on also. I'll see you next time.